Facial fillers are really complementary to Botox and Dysport. They don't do the same things, but they are complementary. Fillers are really designed to fill in lines, creases, hollows, add volume back. Our faces age a lot by loss of fat. So our fat disappears from our body with age, especially our face, which starts to show the bony skeleton a little more. We get hollow under our eyes. We get hollow around the eyes. We get hollow in the cheeks, in the mid-face. We get hollow down here. A lot of aging is because we've deflated the balloon. Just like if you take air out of a balloon, eventually you'll start to get irregular and wrinkly on the outside. That's kind of what happens to our face. Our skin is not as elastic as a balloon, but when we deflate, we get some hollowness. So adding volume back is part of rejuvenation. It's not just a matter of lifting and tightening. That has its role as well, but filling also has a role to fill out the hollows, which smooths the tissues. So the fillers, there's a number of different fillers, and I'm going to just talk about the few that we use most commonly in our practice. Hyaluronic acid products are the most common class of fillers. The two products that we use most commonly are Restylane and Juvederm. Again, different companies that make different versions of hyaluronic acid. Hyaluronic acid is probably the most versatile filler because it's a natural product. It's part of our natural system. It's in our joints and in our skin naturally. This is made synthetically in a laboratory, but because it's identical to our own hyaluronic acid, there's no risk of an allergy or reaction. What hyaluronic acid does in our system is it attracts and retains water. It's a lubricating protein. It plumps tissues by attracting water. So if you inject it into the skin, it'll spread out, you can mold it, and it'll bring in a little bit water and plump that area. So that's how it works. And it's clear and gel-like, so it's safe, it's non-reactive, it's clear and gel-like, so we can use it at any parts of the tissues. We can use it all the way from the bone to the surface of the skin and anywhere in between, and it's very well tolerated. So this is our most versatile filler. We use this in all parts of the face because it is very versatile. Now there are other fillers that do different things, and the next most commonly used one is called Radiesse or hydroxyapatite. This Radiesse is a good product for deeper folds and creases, such as heavier folds here and here, or adding volume to the cheek, lifting the mid-face. And what Radiesse is, it's got a solid and a liquid. It's not just a gel. It's made of small little beads of calcium phosphate. Again, calcium phosphate is natural. It's in our system. It's the base composition of teeth and bone. These small little microspheres of calcium and phosphate are made synthetically, placed in a gel which injects like a thicker white material, almost like toothpaste. And when you inject it, the fluid part will disappear in about 2 months, but those little beads of calcium phosphate will layer out in your tissues. You'll get some collagen ingrowth around those, and that complex of calcium phosphate and the collagen can last for up to 2 years. So it's a longer lasting filler, but it's a thicker filler that we can't use in thin skinned areas like under the eyes or in the lips. We use it only in deeper areas to lift the mid-face, to fill in these deeper folds. Many times we'll use this product deep for the deep folds and then use Restylane over the top for the fine lines and creases, and using those two together works very well. There's one more filler I just wanted to mention, and that's called Artifil. This is the only FDA-approved permanent filler. This is similar to Radiesse in that it's got a solid part and a liquid part. In the case of Artifil, the solid part is what's called PMMA, polymethyl methacrylate. That's actually a synthetic bead that's made in a laboratory. It is inert, so it's safe to put in the body. It is not part of our natural system. It is foreign. But this has been used for many, many years and is very safe and well tolerated. It's floated in bovine collagen, which was the original collagen preparation. Back when you hear people getting collagen injections, that's what they were using, bovine collagen. That was approved by the FDA in 1983. It was the only filler we had for many, many years. And so they pair these together. You inject it. The bovine collagen will disappear in about 2 months. The beads will stay permanently. You'll get some collagen ingrowth around those beads, and that complex will last a long time because those beads will never go away. So this is a longer lasting filler. It's more expensive. I use it primarily for heavy folds around the mouth. If people feel like the other fillers, the Radiesse and Restylane, don't work well enough, we may use the Artefill. This does require a patch test because bovine collagen is not identical to human collagen, and there's a small chance of reactivity to that. The FDA recommends we do a patch test, so we patch test everybody, make sure you don't react to it. If you don't, then you're a candidate for this filler. But I'm not using this everywhere on the face, again, because it is more long-lasting with the potential of being permanent. We want to be careful in what areas we use it. Like I don't use it in the lips or in the thin-skinned areas under the eyes, because we don't want to end up with a lump or a bump that's permanent that doesn't look right. Okay, so let's just see what fillers can do. That's kind of a quick overview of the most commonly used products in our practice. And you can see why this is popular. Just as the Botox can take away frown lines in the upper part of the face, these fillers can really soften lines and creases primarily in the lower part of the face. You can see this patient has a lot of deflation of the face, lots of depressions and creases around the mouth, deflation of the lips. So what I did was I used Radiesse Deep to fill in the deep furrows and the hollows, and I use Restylane superficially for the fine lines and creases, the lip lines, and to add volume back to the lips. You can see the lips look much more pleasing post-treatment, but they don't look unnatural, and that's a very important point. It's really important to me to give you a natural rejuvenation no matter what we're doing, if it's a facelift or fillers. And again, everybody sees on TV or out in the public unnatural looking people who've obviously had some cosmetic work done. And it really comes down to proper technique. So you can see with fillers, it doesn't mean your lips have to look big. You don't really necessarily want to change the shape of the lip. You just want to rejuvenate it. So adding volume back gives more youthful appearance to the lips, but still very natural.
That's a beautiful result. It almost looks like it's been retouched.
Yeah, it does. And this is immediately after the treatment. We did the treatment, and then she has a little light makeup on because obviously there is always, you can see underneath the makeup, there's little red spots from some of the injections. But it just shows you can walk out looking that much better right after the treatment. And it's a very powerful treatment. So here's another area. Just as this frown line between the brows works so well with Botox and Dysport, these are frown lines that occur around the mouth from movement over time. We get these creases that make us look sad or unhappy. And just by filling that here, I just use Radiesse for these heavy folds here and here. And again, a little light makeup right after the treatment, but you can see how that's taken away the frown line, lifted the corner, filled in the depression, and given her almost a smile back, where before, even though she may be happy, you can't tell because she's wearing this frown. So it makes a big difference in the appearance of the face just by taking away some of these worry lines and frown lines.
Is that right away also?
That picture was right away also, immediately after the treatment. Now this gentleman is 3 months out from treatment. So here he is pre-treatment with the frown lines. I did Radiesse. This is 3 months later. He came back for follow-up, and you can see it's holding up quite well. There's still some crease here. We could probably inject a little Restylane to improve that. But at 3 months, you can see he's still getting a nice result. The deep, shadowy frown lines are gone. There's just sort of light, fine lines now left.
Now, how long will that last?
Around the mouth with Radiesse and Restylane, we generally get about 6 to 9 months with the treatment. It will gradually fade. At 6 months, it won't all be gone. Even at a year, it won't all be gone. You probably lose about 80% of it over the course of a year. So anyway, we do the injections. You see how long it lasts. There's a little difference from one person to another. But because there is a lot of movement at the corner of the mouth, the filler will be broken down a little quicker. Areas like under the eyes, which I'm going to show you next, it lasts a lot longer. This is a patient who I did filler under the eyes, used Restylane for that primarily. And this is a year after the treatment, and she's retained 100% of it at a year, or close to 100%. Under the eyes, I have one young lady who's 5 years out from a treatment under her eyes, and it's all still there and looks really good. So it can be permanent in certain areas, such as under the eyes and low movement areas. The more we do it, the longer it lasts. I think your body starts to recognize it as being native. So repeating treatments, you get better longevity, even in around the mouth where there's a lot of movement, so it's more prone to break down. So longevity improves with additional treatments, but will last longer in areas with lower movement, like the lower lid mid-face, than around the, areas like around the mouth where there's a lot of movement. Okay. Another young lady who just did recently, who's had these dark circles since she was a little, really a young child, noticed them her whole life, and in 20 minutes in the office we made those go away. She has no makeup on, I don't think. That was just immediately after the treatment, and she was just thrilled because those dark circles were things she's had her whole life, and they were gone instantly. So she was very, very pleased with that result.